Hello, everyone, and welcome to this COVID-19 vaccine distribution information Q&A. My name is Ben Barber, and this is Deb Burton from RI Elder Info. Hey, Deb.
Hi, Ben. How are you?
I'm good. How are you?
Very good. Very good.
Excellent. So today we are talking about how to get a COVID-19 vaccine for the citizens of Pawtucket.
Yes, I would like to bring up Mayor Grabian and Elizabeth Morera, the Public Health and Health Equity Leader for the City of Pawtucket. Welcome.
Deb, Ben, thank you very much. Glad to be here.
Thank you. All right, so let's get this going. Where can people find out information about the vaccine?
So first, what you're going to see on the bottom of the screen is to go to the city website. We have the COVID hotline as well, and the number is the 855-843-7620. It's where the information is all available in 4 different languages. The website is self-explanatory. Go ahead and click on it, and the multiple sites that we have, both municipally run as well as some of the private partners we have with Simpson's Pharmacy and others, will be there listed as well.
Excellent.
And so when people go on the PawtucketRI.com COVID-19, are they registering to be notified when an appointment is available, or are they actually making an appointment for the shot?
So it's kind of both. You're registering for the municipal runs Saturdays that we have, the next 2 Saturdays. We've already completed 2, and that was for 65 and above, and we're still focusing on those in the municipal. The Simpson Pharmacy, they can go direct on. So for the cities, you go on, and we've got the pre-registration, if you will. They can go ahead and they'll get put on that list. And then we'll be calling them back or emailing them back, depending on what information they provide to us. And we'll do that outreach. On the others, and correct me when I'm wrong, Elizabeth, but on the others with the third-party clinics and providers, they're going directly on to those sites and getting a time and a date. And if I missed that, Elizabeth, jump in.
That is correct. I can add to that. So if you do meet the criteria, which is you're a resident of Pawtucket and you are 65 or older, you can go right on the link that you can see on the screen for March 15th, March 18th through Simpson RX. That will bring you directly to the PrepMod link to register for your actual vaccine. If you do not meet the criteria yet, if you're less than 65, you can fill out the request for information form, which is right on the screen where it says click here, and it just some regular information like your residence, where you live, a phone number, and that's for you to receive a robocall once you become eligible for a vaccine appointment.
So even people who are not currently eligible can go on and sign up to get called for when they are eligible.
Definitely. We want to get your interest information, and if you have access to transportation or if you have a underlying condition, just so we can have that and we can do the outreach once the appropriate time for our residents to get vaccinated.
And I think it's important, it's a first come, first serve. We're following that list to a T based on all the criteria that the Department of Health has given us. Right now it's 65 and above. There are some other communities that are able to go a little less than those ages, and we're not there yet. So that's why we're kind of using this as a pre-registration, a holding pattern. As soon as we get word and we have the vaccinations, and we'll be reaching out to everybody, whether it's through email or through a call.
Great. And so when you start making the calls for the folks that are eligible, how will they know that it's really the city calling to let them know versus a scam artist?
Fair question, right? And with our elderly population, we're really, really concerned about that. And they're going to identify themselves as they walk through it. So the best they can. So it's the caller ID. It's based on their information, and they're going to walk them through the form. If they're concerned about that and they think it's a scam, they can call us, call that 855 number just to verify. Say, listen, I'm a little concerned. I'm going to call you back. They can call the mayor's office, and we have people that are walking them through that. But in today's climate, absolutely, let's rather be safe than sorry.
And will anybody be asking them for their social security number or a credit card or debit card or bank information?
No, not at all. So if anybody asks that type of question, absolutely, that's a signal right there. They're going to ask them, for some background information, their phone number, some of the basic information that they would have anyway. But absolutely, that's a short telltale sign.
Awesome. And is there any cost involved? Do I need to bring a copay or anything like that when I go?
Nope, everything and is no charge. We are providing this additional service, and again, we're trying to, cater to those 65 and above. With our call center, we're very fortunate where we have a partnership with Colette Tours, who has allowed us to use their call center. So that's why we're able to do this. Otherwise, we wouldn't have that capacity. So there's no cost. We're covering that with them, and they're partnering with us, and we have people on staff in 4 different languages.
Oh, that's awesome. Okay, so we get the call, you've got the appointment for the vaccine. Should I come early and wait in line to make sure you don't run out?
You want to go a little bit, Elizabeth? Go ahead.
Right. I would recommend to please not come any earlier. We have put signs out outside and also near the parking lot for our residents to wait in their car. If you want to come early just to see that it's happening, please just wait in your car until 5 minutes before the appointment. We want to avoid having long lines and our residents standing in lines for a long period of time. I will guarantee if you're registered, you will get your shot. Even if it's at 3:30 p.m., that allocation will be there until 3:30 p.m. So please don't think that we're gonna run out of vaccine or anything before your time. So that's a very important question, and thank you for bringing that up.
And the other thing, if I could, Deb, is important. You bring your ID, whether you have a license or some form of ID, just to verify. Your appointments, remember, already been set up. As Elizabeth has said, we're holding even if you're late, right? We're holding that vaccination till the end of the day, 3:30. So you come with your ID, that vaccination will be there for you.
So I just want to make sure all vaccines are accounted for. So it's not as though people should come at the end of the day and kind of hang outside the door to see if maybe there's something left over. You've already got like backup people in line, right?
Yes. So what we've done, and Elizabeth could attest to this, is we've overbooked in some ways, knowing that a percentage are canceling. And so we wanted to protect ourselves that way. So if you have 1 or 2, we will maybe have somebody, but they shouldn't be coming. What we've been doing is giving it to the volunteers there. It's been very minimal, so it's not an issue. So it's really pre-book. If you've got a spot, we'll make sure we give them their shot. So there's no coming after. So yeah, to stay to the format, pre-register, and on that format.
And I would add to that, in good faith, our operations team does call our resident that was scheduled, ask them, are you coming? What's going on? Are you going to make your appointment? Are you running late? And then we do have a list of the people who are eligible, who are on a waiting list that we can call. So that, are you able to make it to Jinx right now? We have a no-show. And then we definitely prioritize our volunteers. So there's definitely a system. So I would not recommend coming out and standing outside and waiting for the end, because there's definitely much more demand than supply right now.
Yeah, absolutely.
Yeah. So the Deb, do you want to talk about the rides? If people need rides to the.
Do you guys have any arrangements so that if folks need transportation to the site, that you've got a contract with somebody so people can get the transportation?
No. So at this point here, we do not have any rides or any contract yet. We're looking at what those needs are. We're trying to work with partnership with the state of Rhode Island. And again, we follow their guidelines, but one of those folks that are homebound, we're really pushing hard with the state to figure out a way. And again, they're trying to, so I don't want to make it sound like they're not worried about folks like that, but it's really about the vaccination, how they control the safety of the vaccination and deliver them. So hopefully, rather than having people being picked up, we will hopefully have that delivery service down the line with partnership. But right now, Deb, is where if somebody calls and they're really stuck in something, we'll send a police officer down, right? To help out if they need to. But it's all those folks who've signed up. We're asking them to get their own rides.
But people should not, for everyone watching, people should not be responding to Craigslist or Facebook or anything like that with anybody saying, I'll give you a ride, I'll pay you, because in effect, you're telling a complete stranger when you're not going to be home, and that's not safe.
Yep. No, you're right. That's the other side of it. Thank you. Good point.
There is MTM, the non-emergency medical transportation provider for individuals who are on Medicaid, or if you're over the age of 60. are able to transport individuals to the vaccination sites. If you're eligible for Medicaid, if you're on Medicaid, the transportation is free. If you are not eligible for Medicaid and you're over the age of 60, it's $2 each way. $4, it's paid directly to the driver. Not the driver as an individual, but the company.
Yeah.
So that's an option. And then I just heard that if you really are still stuck for transportation options, say you're not Medicaid, you're under 60, if you're still stuck for transportation options and you call 211 and choose option 6, they do have Lyft. I don't know if it's gift cards to Lyft or exactly how it's working, but they can provide free transportation to get you to the vaccination sites. Obviously, it's for folks who are really, really in need. That's super important. I want to go back to one thing that you mentioned. When people come to the vaccination site, you said that they need to show an ID. If an individual is undocumented, are they any part of this anywhere along the system? Will that be reported to ICE?
No, absolutely not. No, I know that's always a concern out there. No, there's no reporting. For those that are undocumented that might not have a license, if they don't have one, they can come their insurance card or something that has their address on it just to confirm it's them and they've to match the booking of the department. But absolutely nobody is getting reported. Our job is to get as many people vaccinated as we can and try to make it as easy as we can for everybody.
Okay. And you have that all available in 4 languages now, so that's awesome.
I don't speak them, Deb, but yes, we do.
No habla español.
No.
He'll get there. He'll get there soon.
Yes. Practice. Practice makes perfect. And Elizabeth, I understand you may speak another language.
Yes, I do speak Cape Verdean Creole fluently. I know it's not Haitian Creole; it's a little different. But Cape Verdean Creole, we have a significant population of Cape Verdeans in the city of Pawtucket that are benefiting from having the interpreted info.
Oh, that's wonderful. So maybe towards the end, if you can give that information in Cape Verdean, because our goal is to reach as many Rhode Islanders, and that means all Rhode Islanders. We want folks to get vaccinated. We want to return to some semblance of normal. We want everybody to be healthy again.
Absolutely.
Yeah.
So Deb, do you have any more questions, or is there anything that
one super quick one. When somebody gets the appointment and they go to the vaccination site, if they're using a walker or a wheelchair, can they get in okay?
Yeah, so both facilities that we're using are handicapped accessible. Knowing the population we're trying to serve, we will have some, if somebody has a walker, we've had plenty of people who had spent a little bit of a ways not able to walk. We've got the wheelchairs and other ways of helping them along. So yes, they're there. We have plenty of volunteers. Elizabeth and the team have done a great job. So they're volunteers helping our EMA team, and our volunteers are doing wonderful. So there is, if they have accessibility, but if they have any restraint issues, as they're there, we're there to help them.
Awesome.
Thank you. All right. So to summarize, before we send it to Elizabeth to end, sign up, visit Pawtucket. I'm sorry. I live in Westerly, and my entire
That's a different country.
The entire time I've been doing this, I've been like, do not say Pawtucket. PawtucketRI.com/COVID-19 for more info, or call 1-855-843-7620, and it's available in 4 languages. I am so sorry, citizens of Pawtucket. I am so sorry. All right, Elizabeth, take it away.
Bom, tafla tudo residentes de Pawtucket de 65 anos ou mais, se ainda busca registrar para vacina, pode vai na nosso website, que é pawtucketri.com/COVID-19, ou se você assistência na registra, pode chamar número 855-843-7620, que é para vacina para a clínica na cidade de Pawtucket. Obrigado.
Thank you very much, Elizabeth. Thank you, Mayor.
Thank you both very much.
Appreciate it.
My pleasure.
Thanks,
Take
everybody.
care.
All right. Stay safe, everyone.
You too. Be safe.